I am a volume joint replacement surgeon. We do more than 1,000 joints a year, and currently my practice is about 10% of revisions. But then that is a significant number because it is bound to grow in coming years. It is 10%, it might go up to 20% or 30%. Knee replacement and hip replacement, they are artificial joints. These artificial joints have certain life. Maybe it is 20 years or 25 years or 30 years. But once they are in body for 20, 25 or 30 years, there is a possibility that they will stop functioning well, or they might become painful, or they might become unstable. And that is a time when the patient needs another hip replacement or knee replacement, or in simpler words, repeat hip or repeat knee replacement. And in scientific terms, it is called as revision hip replacement or revision knee replacement. There is no specific age for revision because we are talking only of one aspect where a primary knee replacement or primary hip replacement has lived its life and it requires revision. But then there are a lot of cases where a primary knee replacement or primary hip replacement has stopped functioning prematurely. Now, where it can happen? Suppose in a replaced joint, replaced knee, or replaced hip, there is infection. You need to go inside again. God forbid, the person meets an accident. There's a joint inside and there's a fracture nearby. You need to replace it again. God forbid, while doing surgery, the alignment is not proper. The balancing of the joint is not proper. So instead of lasting 20 years or 30 years, it might fail early. Revision knee replacement or revision hip replacement is an extremely challenging situation because whenever we put an artificial knee or an artificial hip, we bind it to the bone, either by cement or without cement. But once, if the joint is already inside and you have consumed the surface where you can bind the joint to the body, and when it comes to revision, there is not much bone, there is not much surface to bind the implant. So you need to go further in the bone and you need to put a bigger implant. You need to do more tissue dissection. You need to do more complex surgery. So revision surgery undoubtedly is much more complex than a primary knee or hip replacement. You need to be very well trained. You need to be very well read. You need to have good knowledge of all the implants available, and you need to have good skills of a revision surgeon. There might be some compromise in the quality of life, but if a patient reports to you at an early stage where he requires revision, you can give almost results like primary knee or hip replacement. There are a lot of deliberations now going on for the use of robotics in revision hip or revision arthroplasty or revision hip or revision knee replacement. It's an evolving field at the moment. We can't say definitely something about it today, but maybe 1 or 2 years or 3 years down the line, when there are more scientific papers, more experience with these robots, we will be able to tell you how useful it is.